Good Monday morning to you. We hope you're having a great start to your week, a holiday week, so hopefully that means a shorter work week. I know I'm looking forward to that, Gary. How about you?
Yes, it's going to be a great week. A lot of stuff going on, and I think a lot of people are going to make a really long weekend out of this too, Amy.
Can't beat long weekends, especially during summer.
Yep.
And the time now is 9:57 a.m. You're listening to WDBX FM Carbondale. The show is Talk of the Town. We have Mr. Gary Williams in studio this morning, and then myself, Amy Fox. And we're talking about all things Carbondale Chamber of Commerce.
Good morning.
Good morning. Jennifer Olson, I forgot to mention, is also in studio this morning.
I thought I was going to introduce myself this morning.
No, never. And very exciting day. Some big things going on in Carbondale.
Yeah, as soon as we get out of here, I'm going to be scooting over to the new Captain D's. It opens today, and so we're doing their ribbon cutting at 10:30 so we can get it out of the way so they can open lunch on time at about 11 o'clock.
And in addition to Captain D's, you have a slew of things going on throughout the next 6 to 8 weeks. Busy time for the Chamber. On July 16th, you have the monthly luncheon at Hopewell Missionary Baptist Church.
Sure, and I just one more note on the Captain D's is just I think it's another reason to celebrate and be excited when you have national chains coming in. You know, they don't come into markets that aren't performing well. You know, they have the due diligence and wherewithal to do the homework. So I think that's encouraging for all of us to have them joining us at the Chamber and being a part of our city. So on to our regular monthly luncheon, which is Tuesday, July 16th. We've hosted several luncheons at Hopewell Missionary Baptist Church, but this is the first one where their own pastor, Christopher Swims, is actually our presenter also. And he is going to present on something that he's been studying, which is how to deal with conflict in your workplace or in your organization or in your group, and also how do you come out of that to create a healthy culture? So culture and conflict, you know, are things that we get requests about as far as having as a topic. And so we're excited that we have Pastor Swims, who's also on our board of directors, who said, hey, I have some training in that. I'd be happy to talk to people at your regular monthly luncheon. So we have that. And also Hopewell is very busy getting ready for their back-to-school backpack giveaway, which is a huge mission for them. And so we're asking our chamber members who attend, you know, if you can bring anything, swing by and Staples or Walmart, wherever, and pick up some school supplies to help us stuff those backpacks. It just takes a lot of things just per each child to get them ready so that they can go to school with confidence from having a nice full backpack.
And the Hopewell's backpack giveaway is also the nonprofit highlight for that event as well. Absolutely. We wanted to give them, 5 minutes to talk about the program and how it's grown and what it takes to pull that off. We have several members that have assisted with that over the years, and one of the things they always say is how well organized it is. And as somebody who puts on a lot of events, I can tell you when people are complimenting the organizational skills that went into pulling it off, something good and right is happening there. It takes a lot, and so we can all take a lesson on how to give back to our community in a well-ran sort of way. And if someone would like to sign up for that luncheon on Tuesday, July 16th, contact the Chamber directly? Sure. Just give us a call, 549-2146, or visit carbondale-chamber.com, and you can register there. Registration is always sort of a finicky thing. I think here in Southern Illinois, we're not always so good at RSVPing, and it gets further complicated when we put it out as a Facebook event, because how do you ever divine what's happening with interested and going and can't go? There's really not a great industry standard, but it's only fair to our caterers that we give them a good count. Otherwise, one of two things happens. One, we're short and scrambling, and taking the leaders eat last philosophy literally, or two, we end up, with
more waste or giveaway than we'd like.
And on July 25th, you have the Round Pie Straight Talk with someone from the social justice program?
Yeah, from actually right across from the radio station here, Center for Empowerment and Justice. Their executive director, Jennifer Fertali, is going to be our speaker. So the Round Pie Straight Talk is kind of a unique format because it really gives people who attend the opportunity to ask questions. So this is open to our members. Lunch is provided by Domino's, with Pepsi Mid-America providing beverages, and so it's no cost to come. And Jennifer or any presenter, they speak and kind of do an opening segment for about 10 minutes, and then they just take questions. And, you know, it's interesting being on the presenter side. In many cases, you do your best to anticipate or try to answer questions before they get asked, but I think these are really interesting, and the conversation many times goes places that I don't know that the presenter necessarily could have anticipated. And it really gives a more in-depth understanding of, you know, different things that are going on in the community.
Right, and people can also sign up for this, just so you know how much pizza to have, soda to have on hand.
Yes, absolutely, with pre-registration. And also, we host this at the Design Center, which is the space in the northern end of the train depot where our office is. And really, our capacity is about 30. So, unfortunately, sometimes we have to cut it off and, you know, limit, just so that we're safe and we can serve everybody properly.
Right. And getting to the end of July, I know it's hard to believe we're in July now, but we're July 1st, but come towards the end of the month, you have the SI Made Expo, and this is a collaboration between multiple agencies throughout Southern Illinois.
Right. It was the dream and vision of Dale Fowler to have basically a business directory of locally made products and services that you could essentially walk through. Mm-hmm. And so it is over at the Pavilion in Marion on the 27th and 28th. And I certainly encourage people to walk through. It's pretty fascinating. You will find things that you had no idea are made here locally. And they're pretty strict about how, you know, they let people access it, and if it's not produced here, it's not going to be there. But the reason why the chambers got involved with it is kind of twofold. One, the funds from it go to a very good cause, and that's Veterans Honor Flight. And I know Dale's dream for this second annual SI Made Expo is that he would love to fund one of the trips entirely from the proceeds and just wipe one off from other fundraising efforts. And it does cost about $50,000 to $60,000 to send one airplane full of our veterans to DC for the day. So we of course support that, but also super important to us in our mission to see our businesses grow and thrive. Yes, we absolutely want them to have the exposure to the walk-through traffic, your average consumer who might buy some things, but we also want them to network with each other. And that was really the magic that we saw last year was, you know, somebody who is making a product and they find a new supplier for the raw goods to make that product that they had no idea they could get locally. And also on the other end, you know, we found small companies that realized, oh gosh, you know, there's an innkeeper and they only want to feature locally made soap and candles and shirts at their location. So people found resources to produce products, and people also found new points of sale, new outlets for their product to be featured. You know, there's a lot of people who are makers or producers, and they may be selling online, they may be setting up at farmers market, but they don't necessarily have a brick and mortar retail storefront or outlet that way. And this kind of gives them some new channels that they might not have already thought of. So there's some real magic and synergy that happen really among the businesses. And so we are trying to let people know that there is a handful of exhibitor booths still available. They're very affordable. I think last I knew it was just about 20 booths that were left available. So if somebody has something that they're producing beginning to end here in Southern Illinois, it is a really great opportunity to capture both a consumer person who, just walks through the vendor fair on a Saturday or Sunday because they're curious about locally made and they want to shop local, and also gives them a great chance to meet other people who are doing the same thing. And, just to hear the conversations, so many times they're having the same experiences dealing with doing business here. Pros and cons, and just having another person to talk to that's in a similar or related industry goes a long way for people.
And is there any type of admission fee for people to come check it out on either July 27th or the 28th?
So it is a suggested donation that goes to Honor Flight. Okay. So I say that because the cost of actually hosting the event are underwritten by sponsors and the vendor booths themselves, so the money can be preserved to go to Veterans Honor Flight. Last year, the sign that was out, I believe, said suggested minimum of $5. I can tell you I saw a lot of $20 bills, $10 bills flying into the bucket, so people really believe in the cause and they're willing to move forward, in order to go see the neat things that are out there.
And if someone is listening this morning and would like to reserve booth space, who do they need to get in contact with?
They can go through our website or they can go directly to simade.org. Either way.
Mm-hmm. And then on Tuesday, July 30th, you have your Networking at Noon event. And these are very casual, relaxed atmospheres.
Yes. We always try to have on the last Tuesday of the month, we just pick a restaurant that is a chamber member and go there informally. When you do a lot of structured programming and you have set presentations or it follows a Q&A program, people do find time before and after to network, but this is just straight networking. People just meet there, they pay for their own lunch, and they just have the opportunity to hand out business cards. And it's interesting because this is really growing. We had one at Tres Hombres last week, and I think we had 11 or 12 registered, and there was probably closer to 20 there. And there were definitely some newer businesses or businesses that we had not seen represented in a long time. So I think people understand the value of a handshake and an introduction. And, I'm just thinking of somebody, Ray, who is with Uppercuts, he's a barber, so it's a person-to-person business, really. And so he's like, well, I guess I should really be sending the owner to these things. I said, no, I mean, if the owner wants to come, great. But I also think it's important when you're in a service industry that people get to know you also, because they're going to come in and ask for you, not just walk in and take whoever typically.
Right. And where will this month's be at?
I don't have the location pinned down. To be announced. We have a couple of thoughts on that, but we want to make sure, because sometimes when people are newer, we need to actually push that visit back until they're up and running about 6 months. That's what we did with Freddy's. Mm-hmm. We didn't bombard them right out of the gate. We gave it a few months, and then we went back and did Networking at Noon a little bit further into it.
Great. So stay tuned for that announcement.
Yes.
And a week from today, Monday, July the 8th, the Lift Mentoring kicks off with Luncheon. So, Jennifer, tell us a little bit about this program.
So this is the soft skills mentoring program. It really is, I hate to use the word job shadowing, because it's really less about learning someone's specific job and more about learning how they got to where they are. So, it's true mentoring in the way that, you're going to hear the good, the bad, and the ugly. I think sometimes when you're a young person, and this program is targeted towards 18 to 24, either unemployed or underemployed, you see somebody who is running a business, whether they're an owner or a top position, and you think, wow, they just got here overnight. And we've encouraged our mentors to work with the young people to understand, all the trials and tribulations that it takes and all the twists and turns. And, there's really, for many people, not a perfect career path. We don't always get our dream plan. Sometimes things twist and turn. So we just ask our mentors to commit to a 9 to noon schedule Monday through Thursday with each of the people at a minimum. And we kind of did a beta test. We had one person who completed the program. It was super successful. She is in contact still with a couple of her mentors that really kind of connected. And so we have 3 or 4 candidates that are kind of sitting out waiting for a match with a mentor. And what we're doing on Monday is we're having all our mentors who went through round 1, and we had a few that were available for round 1, but we didn't have enough dates for everybody, which is a good problem to have more mentors than mentee need. And we're bringing everybody back together, and we're asking each of them who had the experience, who now can explain it well, to bring one more mentor with them so that we can grow the program and accommodate getting those 3 or 4 people up and rolling, hopefully well before the end of July.
Great. And we are quickly approaching our 15-minute mark, but I know you have several other things in the works, currently working on the Carbondale Connections Guide. There's a lot of things that go into that, and planning to put that publication out. But people should expect to see that. Is it August when it comes out?
Right. It always comes out right before back to school. And it goes through a lot of channels, like out through the university, physician recruiters. It also goes out in the Southern Illinoisan. So it has a lot of avenues. So we're busy writing right now, trying to highlight our community for prospective and current residents. And other than that, we are in full gear with Saluki Pride, getting ready for back to school, which includes a lot of planning around paw print painting, welcome events. We still have some prospective students coming to town, both through orientations, through Dinner in the Dale, and we have just over 60 international students that are coming in 2 waves in the middle of July. So lots of things happening. I think there's a misunderstanding sometimes that our Saluki Pride Committee is slow in the summer, but this is really their busiest time because so much of their work is about back to school.
Great. And I know we try to cover a lot of information, so listeners can, of course, be a part of all the exciting things going on at the Carbondale Chamber of Commerce. And Jennifer, the best way for people to get in touch with folks at your office? 549-2146 or carbondalechamber.com. We're on all social media, but I feel most confident saying Facebook and LinkedIn because I think that's where we kind of do our best work at keeping people informed. Great. We'll let you go off to your Captain D's ribbon cutting at 10:30.
Yes.
Once again, Captain D's opening and location.
Oh, goodness. I'm not going to pin down an address, so I will just say Route 13 and Lewis Lane.
Former DiMaggio's location.
Former DiMaggio's, yes. Right by Panda Express.
All right. Looking forward to it. Thanks so much, Jennifer Olson with the Carbondale Chamber of Commerce. We're going to take a short break and get you some announcements, and we'll be right back in just a few moments.
Good morning, this is Alicia with the City of Carbondale here to bring you this week's calendar of events. On Wednesday, July 3rd, 2019, beginning at 12 p.m. to 1 p.m., the Brown Bag Concert will take place at Town Square Pavilion located at 121 North Illinois Avenue. The featured guest is Kristen Kearns. For more information, please call Carbondale Main Street. And on Thursday, July 4th, 2019, the City of Carbondale's fireworks display will take place beginning at 9:15 p.m. at SIU Banterra Center located at 1400 Arena Drive. The City of Carbondale has partnered with SIU to bring the annual fireworks display back to campus. Parking will be available at the Banterra Center lots. In the event of rain, the city's fireworks display will be held on Friday, July 5th at 9 p.m. For more information, please call 559-1939. For information on these events and others, please visit our websites at WDBX.org or CarbondaleTourism.org, or you can reach us by phone at 618-457-3228. Thank you and have a great week.
Good Monday morning to you. The time now is 10:17 a.m. and we're joined in studio this morning with Angie Bailey, the SIH Community Benefits Manager. Thanks so much for joining us.
Great. Thank you. Thanks for having me today.
And today we're going to be talking about the Community Health Needs Assessment. This is the 2018 report.
Yes. So every 3 years, because we're a nonprofit hospital system, we must do a community health needs assessment. And it's been something we've been engaging in with health departments for 15 to 20 years, but we've been doing our own. This is our third version. And so we defined or selected 5 priority health issues for us to work on over the next 3 years.
Right. And I'm sure it takes a lot of time to prepare this document, a lot of research, but probably very interesting findings, not only for SIH, but the community at large.
Yeah. So the data we collect, the process is about an 18-month process. So we look at all kinds of data from state and federal data and how our counties and our communities compare. So it's always interesting to see kind of what pops out as things that are the health issues that we really need to face. So the 5 issues that we're looking at, working on are improving access to health and health care. So the first one, that's really looking at a lot of things related to social determinants of health, like poverty, transportation, those types of things, housing, and then also looking at behavioral health. We know that continues to be an issue in our area with substance misuse, opioids, those types of issues, cancer, chronic disease prevention and treatment. And then our final issue is improving health behaviors with a focus on tobacco, overweight, and obesity.
And these are issues that you're finding all across the various counties here in southern Illinois.
Yeah, so in the report, we really look at our 7-county service area, and we have a 7-county area because that's where over 90% of hospital visits as well as visits from the community to the community clinics occur. So it all varies by counties. But kind of some examples of some of this data in our region, 14.4 to 23.4% of people, depending on what county you live in, are living in poverty, where in the state, this rate is about 13%. So we have much higher rates. In the United States, it's 12.7. So we know those are issues we're facing in southern Illinois.
And when you did this report 3 years prior to that, are you noticing a lot of difference every 3 years, or is it pretty steady?
So it's pretty steady. Poverty, access to health care and jobs, and poverty continues to be an issue. Like I said, cancer, we have some that continues to be an issue. You know, many health behaviors contribute to that, but also access to health care again. Some of our counties have the highest rates of cancer in the state compared to other kinds of cancers. Also chronic disease. As our populations get older, we tend to see more chronic disease. We had a press conference at the beginning of May announcing this, and one of the things that really stuck with me that one of the cardiologists said at the press conference is, many times when you're young, you're not thinking about all these health behaviors that are going to lead to issues later on. When you get in your 40s, 45, 46, 47, in that range, they start to pop up. And that's really when you need to start doing something about it. Because if you don't by then,
by the time you're 65 or older, you're going to be those individuals with a lot of these chronic health conditions. So I thought, that really sticks with you as how important a lot of these health behaviors are, whether it's nutrition, physical activity, and tobacco use, getting your required screenings, just how important they are to find these issues early, help you treat them or prevent them or reverse them if possible.
And I'm looking on page 5 of this report, and it says that nearly 900 people provided input throughout the CHNA process. And there's a lot of different methods that were used.
Yeah, so besides looking at the data, we also did a community survey. So for the community survey, we had 699 respondents to that, and we did it through SurveyMonkey, so people could do it on the app on their phone or on a computer. And it just asks questions about what do you think are the top health issues in our community, and what do you think are the top health issues in your home? So it was really interesting to look at what people said in the community versus their home. I think that's when some of these issues maybe came to light more, when people are being more honest about that. We also surveyed physicians and key leaders within the community and SIH. And then we also had a 37-member advisory team who included health departments, people from SIU, that really worked at helping us narrow down these priority issues, because there's so much we could take on and tackle, but it's really hard to make a difference and make change. So we're trying to kind of slowly bite off at certain things and make improvements.
And what does the implementation look like for everything that we've discussed this morning? There's so many different things that you could, so many avenues you could go down.
Yeah, so it varies. Different initiatives are happening. So one thing is we work with the Healthy Southern Illinois Delta Network, which is a coalition of about 400 members in Southern Illinois. If people haven't heard of it, there's a website. It's hsidn.org. There's a Facebook page, and we're getting about 90,000 page views a month. So of people looking at events, looking for tobacco cessation or chronic disease classes in the area, just other community events. And then working on other smaller projects that aren't kind of regional, but kind of working with Gary and the city on some things around mental health and behavioral health and safety, and kind of what can we do. Those things are just kind of getting started and in the works, but things that over time I think can make good improvements.
We've also, as you know, in the past we've worked on some issues with bicycle planning and different things to promote folks being more active in the community. One of the things that I was curious about, and I didn't know if it was touched on in here, is obviously because of our health outcomes are poorer than they are in other areas of the state, there has to be an effect on healthcare cost, right? And so for folks that are buying your own insurance, or even for an employer, there's a consequence to that.
Yeah.
Right?
So if we can control healthcare costs and people getting the health issues later in life that are going to be more expensive, and through that prevention, we can help reduce costs. So with some work sites, like SIH works with our work site to see whatever we can do to prevent some of these issues and get people active and get people to those screenings. So if they do have something, you can catch it early. So for employers, it's a great thing to do is take that focus and look through things through that lens of trying to help your employees early to help reduce those costs. So good point. And with the bicycle efforts, one thing, even you were talking about the new opening today, and that the city has really done that's, I think, is exciting, and whenever I go to new businesses, I'm always looking at it, is the bicycle racks and the sidewalks. So there's ordinances and things that require the bicycle racks and the sidewalks near. So I think that's all really improving our built environment so we can help people improve their health.
And it really seems like it is a community effort. It's not just one entity. It's not just SIH. It's not just the city, but it really is a collaborative effort between many different partners, not only here in Carbondale, but throughout the region as a whole.
Yeah. So, like I said, within the HSIDN, there's over 400 partners, and really it's just working slowly together at these different issues, because we don't have as many resources as some areas and communities. So it really takes us all working together to try to create any type of change.
And Angie, if someone would like to access this report and implementation plan, is there somewhere that they can go to get a copy?
Yeah, so we have an executive summary, so it's about 30 pages, and so that can be found on the SIH website. There's a section called Giving Back. So you go to that page and then to community benefits, and you'll see it there. You can download it. You can also call me at SIH. We have plenty. We can mail out free copies of the executive summary. But if you're somebody that really might write reports or want some data for your business or company, or we have a 300-page document that includes all the data, and that's also available on the website. So I'm 457-5200, extension 67834, and that's how you can get a copy mailed to you, or we can send you the email link.
And is there anything else you would like to mention about this report that maybe we forgot to ask you?
I would just say part of it, we have all these health issues in Southern Illinois, but it's just knowing what they are and really moving forward as a group to address them. So it's going to take time, and there's always kind of forces against us. Our data is not always the newest. So I think by working together and collecting our own data and keeping that information in the forefront, we can make progress.
Great. Lots of good information. Angie Bailey with SIH. Thanks so much for joining us.
All right. Thanks so much.
And that does it for us. We hope you have a wonderful 4th of July, and we'll be back next Monday.